Hi, my name is Courtney Dubois and I'm a child life specialist. One of my job duties is to help children cope positively in the healthcare setting. So today I'm going to be talking to you about some common comfort positions that you can do with your child when they have to get an invasive procedure in the hospital or at the doctor's office. So what are comfort positions? Well, the purpose of comfort positioning is to increase the comforts of infants, children, you, who is the caregiver, and also medical staff during procedures, which are presented in a less threatening manner. The goals of comfort positions include a secure hold for the procedure, close physical contact with you. This is because it's important to hug one another. Hugging is one of the comforts of childhood that is not abandoned in adulthood, and it benefits nearly everyone during stressful times. Hugging not only limits the child's movement, but is a positive and comforting act. Another goal is incorporation of a sitting position, which promotes a sense of control. Immobility of the extremity is successful. The table and chair does not move if the child moves. And also, fewer people are needed to complete the procedure. During an invasive procedure, you and your child will go to the treatment room. We never do invasive procedures in the child's bedroom. And this is because using only the treatment room for procedures maintains the child's room as a safe haven. It also preserves privacy and moves the child's cries away from other children. So now that you know that information, let's talk about some common comfort positions for different types of procedures. The first one is two people hold for IV start. This is where the patient is sitting chest to chest toward you with their legs off to each side. You will provide a really tight hug for your child, and legs can only kick from knee down, so that's very secure. And this arm, the other arm, is going to be secure by the nurse or whoever is performing the IV. The child can either watch, they can look away, or they can focus on some form of distraction. Another comfort position is called forward facing for the labs or IV. And this is where the child is forward facing, sitting on your lap. The child can either face the procedure or attention can be diverted to the side, just like that. And this position is also great for older children as well. Another comfort position, IV placement in the foot. This is where the left hand secures the foot that is not being used for the IV. And the right hand holds the upper part of the opposite leg, and that hand will hold the foot for the IV placement. This sitting position will decrease the ability to kick and move the leg. Also, both you and the staff are close and able to comfort the child. It's important to hug your child very close and even hold their hand if necessary. Another common comfort position is if the patient has to get an injection in the thigh. This is where the leg is bent over the parent's lap, keeping the thigh muscle thoroughly relaxed. And you can give your child a very tight squeeze and hug, just like that. If your child has to get their port accessed, there is a common comfort position that you could do. This is where the child will sit forward facing on your lap, and you can hold your child just like this and cross your legs over their legs, just like that, which would prevent them from kicking. If your child has to get an NG2 placement, there is a common comfort position for this as well. This is where the child is braced up against your shoulder or chest, just like this, with your hand over them. And this secure and comforting hold allows for immobility of the head and easier placement for the tube, which is going to go right around the nose area. And it can also be used for nasal swab procedures. And this gives the child a very comforting touch. So what are the benefits of comfort positioning? It helps children feel more in control during a potentially stressful procedure. It allows you to have an active part in your child's care by providing comfort touch to lessen the length of procedures and use less staff for holding. Sometimes less sedation medication is needed for successful procedures as well. It allows your child to feel secure in your arms. It's just so important. It provides a positive procedural experience, so children may not be as fearful for future procedures. Without feeling so restrained, a child can more fully engage in diversion and self-calming techniques. There are many different methods of distraction that can be used during comfort positions. The type of distraction that is chosen should be developmentally appropriate for the child so that they do stay engaged. So for infants, distraction could include soft music, comfort items, and developmental toys, such as a blanket or soft stuffed animal. For toddlers, distraction can include items such as glitter wands, music, books, light spinners, cause and effect toys, sensory toys, and bubbles. For preschoolers, distraction can include items such as toys with lights and sounds, young versions of I Spy books, cartoon slides, stress balls, pinwheels, and bubbles. For school-age children, they can benefit from I Spy books, iPad, games and activities, music, singing, having a conversation with you or whoever's in the room, again, stress balls and pinwheels and whistles. For adolescents, they're a little bit older, so a lot of times they can benefit from you just giving them an iPad with games and activities loaded on it, having a conversation with them. They like to listen to music a lot of times and, sing. They could play Hangman and Pictionary, and stress balls are also great for this age group as well. I hope they found this video helpful, and thank you so much for watching.